Welcome to the channel. It is Dr. Durst, and today I wanted to deep dive into hair. So it seems to be a frequent complaint or concern for men and hair thinning. And so obviously you have an androgenic male pattern baldness, which means that you start to thin in the front, you get receding, and then it slowly kind of thins more in the back. But even at the crown of the head is a very common area for men to start to thin. And so just know that there are some things you can do. So we have this question all the time, things that guys think about. It's performance, not just sexual, but overall, like, am I doing well in the gym? Am I able to build muscle? So performing, it's natural for men to compete. So I think that performance matters. I think eyes matter, and I think hair. Those are the three things that come up on a daily basis with men in the office. So as far as hair, there are some things you can do. Number one, don't go Google and look for products. So if you look for Propecia and you start looking at like a 5-alpha reductase blocker, just know that this is more of a localized condition. So why would you want to take a medication for that interferes with an enzyme that converts testosterone to dihydrotestosterone? Dihydrotestosterone makes a lot of men feel better, so they don't like that blockage. And again, that is 10 times stronger than testosterone. So again, some men feel better. But if that's high and that's an issue, then of course blocking it might be appropriate. But you'll go down a rabbit hole on Google looking for what you can do to improve hair. And if you start taking an oral medication for a local problem such as hair, then you can end up with erection issues. And some of those are reported to be irreversible. I don't know that that's necessarily true. I feel like we can probably reverse if it's not something you've done for a long period of time. But just know that it is a local issue, and there are 5-alpha reductase inhibitors that you can use topically that help that concentration of DHT, the stronger metabolite, in the hair follicle, because it doesn't mean that your level is high in the blood necessarily. It can just be that it's concentrated in the hair follicle. And so using a topical that helps prevent the action of it is good. And there's lots of topicals that we can do. We have a favorite one in our office that has 5 different things on it. So it has minoxidil, it can have finasteride, which is the blocker we're talking about. In place of finasteride, you can do a peptide, but it also has caffeine, tretinoin. There are other agents that are shown for hair loss and thinning as well. But Nutrafol is a top, line supplement for improving hair growth. So that's something you can take at home. A link in the description, because it is something that we sell a lot of in the office. And then there are some injections we can do, and there are some lasers we can do. But also just think about one thing. Men don't always think about beautifying, but if you think about a hydrofacial in women and they're at the med spa and they're getting the hydrofacial, which is a machine that sucks dirt out of the pores in the face, it's amazing for men too, just so you know. But you can actually do that for the hair follicle. So instead of doing it on your face, you're doing a hydroscalp, where we take that machine and we suck out all the dirt on the hair follicle, and you're kind of stimulating that growth in that hair follicle to get more into the active phase. So that's a simple treatment you can do in an office in a med spa, and it's called hydrofacial. I don't know that they'll always list it as a hydroscalp but you can do it on the scalp instead of on the face. And then there is PRP injections, where we draw your own blood, spin it down, and get the platelets, and those platelets have growth factors, and then we re-inject them into the scalp. It's not going to regrow hair in a receding hairline area. You still have to have an active hair follicle there, but it is awesome for stimulating the hair growth. It basically prolongs the active phase and gets it out of the resting phase, the hair follicle, and into the active phase, and then prolongs the active phase. And so we want the hair follicles, finicky. It's going through a cycle. And so we want to try and hit it during that active phase. And so we basically are doing this once a month for 3. Very well tolerated. It's an in-office procedure, 1 hour. Again, is it the most comfortable? I'm always going to be honest. There's a little bit of discomfort, but we easily can control that with a laughing gas or, some topical numbing. So it is definitely not something people don't return to get more of because it's that painful. So it's just a mild discomfort, and it's quick. It's a very quick procedure, and it's awesome. And we do it once a month for 3 to stimulate that hair growth. So the earlier that you noticed a hair thinning, the quicker you want to get on that. And the crown of the head is a perfect area for that. But in addition, you can do a laser, and KeraLase is the laser treatment that we use for it. And KeraLase has great studies for, again, improving hair growth. So it also improves, as you see the hair follicle come out, instead of just having one, you'll have multiple coming out of one hair hair follicle, and it increases that. It increases the thickness of it. We can do that in addition to the PRP injections. It's actually PRF that we use in the hair, which is just a second generation. PRP, it's more robust with some growth factors, and it stays and releases those growth factors over a period of time. So if you look for PRP, that works great. PRF is just a more advanced procedure for that. That's what we use. And then KeraLase, when we're doing the PRF once a month for 3, KeraLase is something we can do in between. So every 2 weeks, so that in between your PRFs, you're actually getting 6 treatments of KeraLase, which is a fractional non-ablative laser. So we just use the laser to create microchannels in the scalp where you have thinning. And then we actually put a topical growth factor on the top of that. It has multiple growth factors, and it's called Care Factor. So it has keratin and growth factors in it. And that topically now goes into those microchannels we've created with the laser. So hair regrowth and hair thinning is a huge issue for both men and women. But again, it's something we hear on a daily basis for men. Just know there are lots of things you can do. The earlier you get on it, the better. And the more ways that we hit that, the better. So taking a supplement with all the nutrients in it that you need for the hair follicle health, and then to hit it with the PRP injections, to also add 6 more touch points with a KeraLase laser. But even just think about the simple stuff of Nutrafol and a Hydroscalp to start, and just look for an office near you that does hair. And of course, you can always come and visit us as well, because we see a lot of patients from outside the area, and this is one of the big treatments that we do a lot of. So anyhow, let me know if you have any questions. Also, let me know if you have an experience you'd like to share with any of those laser treatments, the injectables, topical versus oral, finasteride or Propecia that you might have taken in the past, and any issues. So just let's deep dive into anything that you want to. So drop some comments, let me know, and don't forget to subscribe.